Hey guys, Dr. Sherhammer here. Hope you're at home recovering well. So here's just a few tips about post-prostatectomy recovery for you to consider as you go through your journey here. So first bit I think that's important to work on is actually the recovery of urinary incontinence. So what you'll notice for the first few weeks or maybe even months after the procedure is leakage of urine. That leakage will typically be with cough, sneeze, and urgency. What you'll find is that as you stand up, as you get up from the couch, as you do different things, that you'll have some sort of leakage events with that. But hopefully that will get better, honestly, on a week by week basis. So most guys start off with Depends, and I've placed a link to a good brand of Depends on the side there. And so most guys start with that, and then we'll typically transition over to pads. And so one of the things that will help kind of move your recovery along is the use of Kegel exercises. My recommendation is to do them in the morning and at night, and they're really typically easy to just do throughout the course of the day. And so there's a link just below this one where they actually teach Kegel exercises in a pretty robust way. And so there are good Kegel exercises that can be done at home. And then there's good ones that can just be done, on the go or at the office or sitting at your desk or at church or what have you. So more Kegels the better. No one can really do too many Kegel exercises, typically speaking, to be honest with you. If the urinary issue continues to be a problem, we can always consult with the pelvic floor physical therapist, and they can teach you Kegel exercises using biofeedback. And so if you would like that, then just mention that or send us my 10 minutes a message, and we will absolutely get that teed up for you. So that's the urinary incontinence. Am I free to walk after surgery? What can I do? I say walking's free. So if you can walk up to a mile every day just to keep your legs going, keep your heart going, keep yourself moving, that's great. The first week, this is probably not realistic, but then after that, just getting on your feet and getting moving is better. For one, it prevents things like DVT, and I think overall just helps helps enhance recovery, because so much of the recovery just kind of has you sitting and laying down in bed. So get up and walk. Diet. For the first week or 2 weeks, it's just whatever you tolerate, whatever you want to eat. Lots of people notice that their appetite is actually lower for the first 1 to 2 weeks, and that they slowly comes back after that. So the first 1, 2, maybe even 3 weeks, just eat whatever you want, eat whatever will go down and stay down. And then after that, my best recommendation is just to continue on a heart healthy diet. So moving forward. Erectile function. So my recommendation for erectile function is to start on a daily 5 milligram Cialis pill. The daily 5 milligram Cialis is 1/4 of the dose of the treatment Cialis dose. So treatment Cialis is 20 milligrams. 5 milligrams is sort of the daily prophylactic dose. You take it every morning, and the nice thing about Cialis is that it has a longer half-life, so it actually stays in your bloodstream for longer than some of the other PDE5 inhibitors, so this would be Viagra. The longer half-life allows it to stay in your bloodstream and allows it to promote healthy blood supply to your penis and the other organs in that area. Daily Cialis has been, in some studies, shown to improve erectile recovery after surgery, and has a side benefit of decreasing some urinary urgency. So most guys after prostatectomy have some urinary urgency for a period of time that slowly recovers, and we think that the daily 5 milligram Cialis helps with this. So there are 2 links on the side, one for GoodRx and the other for Mark Cuban Cost Plus Drugs Pharmacy. If your insurance does not cover this medication, which most do, but if it does not, then we can absolutely order it through either Mark Cuban Cost Plus Drugs just to be delivered to your home. It's typically $10 a month, or GoodRx allows you to, you can look at the link on the side, allows you to get the medication at a local pharmacy that supports GoodRx, and those two would be without insurance. That would just be paying out of pocket cash, and they both typically range in the $10 to $12 a month range. The last bit for penile recovery after radical prostatectomy is the consideration of just penis pump. And so there's a pelvic floor physical therapist, and his videos are actually further down on this screen. But what he advocates for, and I think it's a good idea, is your penis is made up of smooth muscle, venous tissue, and then collagen. And so this the penis pump, using it just once in the morning and once at night, helps stretch that collagen, so that when you go to get an erection, that tissue is just a little bit more flaccid and more easily stretched. And so recommendation is link is to the side for this one. It's $30 on Amazon. You can buy it. Put it on there and pump it up a few times in the morning, hold it for 30 seconds, let it go, and then a few times at night, to go along with your Kegel exercises. And then this will help, the Kegels, of course, with the urinary continence. And then, some studies do show that this does have some benefit for erection recovery. The last bit is, if we need to discuss anything more for an advanced erectile dysfunction care, we can absolutely do that in clinic. So there's definitely lots of options beyond these, but these are just the first bits to get you going. So absolutely wish you well on your recovery, and we're here for you if you need anything. Thanks.